Hi, my name is Andrew Granello. I'm presenting a SOAP note case for my patient that I saw in the clinic today. She was a 16-year-old Caucasian female and presented to the clinic with her mother. Her chief complaint was that she's a follow-up patient and she was struck in the head by a volleyball. She's taken Tylenol with little relief. She reports mild headaches that won't go away. So that was the main complaints. She took Tylenol, no relief for the headache or any of that. She has no active medical problems. She's up to date with all of her vaccines, no current surgeries, never hospitalized. She has allergies to codeine. She's on no current medications. Okay, both her grandparents are living, both her parents are living. The only thing is her grandfather has diabetes. So she reports that she doesn't smoke, she doesn't drink, she's not sexually active. She does exercise 3 to 5 times a week, playing volleyball. So in her review of symptoms, we found, again, she complained of the headache, she complained of neck pain. She also said that she had some blurriness to her vision. Okay. On physical exam, she did have some tenderness, moving her neck, rotating her neck back and forth. She did report some tenderness. When I palpated her spine, she did report some tenderness on C3 through C5. We also did a thorough neuro exam using all cranial nerves, so she could smell fine. She smelled oranges fine. She had good ocular motor skills. She could go everywhere direction. Her visual acuity was 20/20 in both eyes, so no abnormal changes there. She could move her tongue, hypoglossal, intact. She could hear well, negative Rhine. Normal Rhine, normal Weber, no indications of anything there. Spinal accessory, cranial 11 was intact. She felt the same on both sides of her face. She could smile, she could frown. I also checked all her strength in her extremities, equally bilaterally in the upper extremities, equal bilaterally in the lower extremities. She could also walk with no dizziness or no abnormalities. She was alert neurone times 4 throughout the exam. She passed the neuro test. So one thing I did with her was we ordered, there's certain criteria using MD-Cal called PCARN, and PCARN is the test we can use to rule out imaging, and we were able to rule it out because it was no obvious fracture for the occipital bone. So if there's no obvious fracture, you can rule out imaging and just do watchful waiting and see what happens. So to treat this patient, we asked her that she could switch from Tylenol to taking oral ibuprofen for headache, and we went through that route to treat her pain. She could come off the Tylenol. My provider my preceptor and me both believed it was mostly musculoskeletal, and she was getting a headache because of the tension in her neck. So we thought an anti-inflammatory would work good to bring that inflammation. The mother also came up with a good idea that she could go and have a massage. We were supportive of that. We think that relieve any kind of tension off the neck would be very helpful for her to review those headaches. So we told her if she still has headaches, still has symptoms in 4 to 5 days, please come back and see us. And then we would probably, at that point, order the imaging and order an x-ray, make sure everything looks okay and there's no fracture at that point in time. Okay, that would be the follow-up. Thank you very much.